First, I wanted to talk a little bit about what's going on in the news and everything. We're hearing a lot about the coronavirus. And the coronavirus, as we know, it's a new virus. The coronavirus family has been there before. It's been here since the SARS and all those things. But now this is a new virus that has come and originated from Wuhan, China, from their South Seafood China open market. So unfortunately, it's been passed on from an animal to humans. That's the origin of it. But what we need to do to protect ourselves, as we know that it's basically turned into a pandemic now. It's more than 60 countries now have people suffering from the virus. And it's basically like the flu or the cold virus in terms of protecting yourself from it. There's no need to panic, but it is important to take some precautions so that we don't get devastated by its effects. Specifically seniors. So, there are a lot of seniors here. So seniors have to be careful and have to take on extra precautions with personal hygiene, not going to a lot of crowded places where there's many different types of people, and really, keeping aware of your surroundings, making sure that if you see someone is coughing or sneezing or someone looks unwell, you want to stay away from them and keep your distance. And also, I think it would be very smart that we stop shaking hands for a while and just go like this, like we do normally culturally. We'd go like that with the females, so we can just go like this, say salam alaikum. It's great. So it's very important to do that, and that'll protect you. If you do get it, we're in a good place. There are good hospitals, good protocols that we have. The CDC has given all the hospitals and clinics around the local areas advice, and they'll test you for it. And then if you do have it, what they'll say is you have to keep yourself isolated for 2 weeks. They'll keep you isolated 2 weeks, either at your house or at the hospital. It's not the end of the world. Don't panic. Just keep clean, keep healthy, and make sure you're hydrated. Now, at this stage, it's important to keep your hydration, meaning take a lot of liquids. We don't want you to feel emaciated or dehydrated. And then secondly, I want you to take your extra vitamins. If you take vitamins every day, make sure you're taking them regularly so that your immune system and your defense systems are high in case you face that pathogen, so your body can handle it well. And then also another good thing is if you obviously washing your hands multiple times under warm water for 20 seconds or more. That's the recommendation from all the CDC and the health authorities. The other thing is to do warm water saline gargles. So a lot of, like my mom would tell me when I had a sore throat growing up, get some warm water, mix it with salt, and then gargle it. So you can gargle it as well as put it in your nose to make sure that it's clean and it's a barrier for entry of the virus. The masks are overkill unless you have the symptoms. If you have the symptom, then you put the mask on so others don't get it. But you walking around with masks, you're going to be touching your face all the time. Adjusting the mask, you increase your risk of getting other viruses. So don't get the masks unless you exhibit those symptoms, okay? So those are the kind of things about the coronavirus that we need to be aware of. Yeah, there's been about 10 deaths in the US now, but it's nothing to panic about. It's very important to remain calm. Additionally, if you can, and if you have access, some people get IV vitamins. IV, they get it with the bag, and that boosts you very well. So we offer that in our Irvine location. If you're nearby, come in, get it. We'll give you a special deal. Medicare covers it. If some people have Medicare, straight Medicare, it covers it. You can come and get that. That gives your body strong immunity for 10 to 12 days. So people do it once every 2 weeks, 3 weeks. They come and they get an IV, and that just boosts their immune system as well as all their amino acids, all the vitamins and all the nutrients in the body. So that's very important to keep in mind. So you can do those things. Do you guys have any questions on the coronavirus?
Any vitamins? Did you say extra vitamins? Like you don't get a IV, which other?
The multivitamin. Vitamin C is good.
Vitamin C.
Yeah. And then the multivitamins. Yeah. And then there's other herbals that people take. Elderberry. Elderberry is good for the immune system. It comes in what they call sambucha. They call it SAMBUCEAU.
Orange.
Yeah. So that's good for immune boosting if you can't do the IVs. But If you could do the IVs, that's ideal because 90% of it gets absorbed. The ones that you take orally, only 30 to 40% get absorbed. The rest goes down with your, waste system. So it's very important to do that and keep yourself and your family and your offspring, kids, grandkids, whoever you know, make sure that they're washing their hands and guarding themselves from such things. If you have any upcoming travels, I was going to go to Umrah April 1st. We canceled it, obviously. But if you have any other travels to different areas, I would postpone it or delay it. Just stay put because we don't know what's going to happen. It's going to increase rather than decrease for a little bit until they get a handle on it.
For the
But
IV,
Saudi Arabia cancelled though for the Umrah people.
Yes. Yeah, they stopped giving Umrah visas and business visas. And business. Even for business, they don't want anyone coming right now. And then Italy is another area that's hard hit. Iran, Italy, Japan. These places have, and in the U.S. now, they're testing more, so you'll see more incidents. You'll hear about in New York, New Jersey, Washington State, Florida. You'll hear about more incidents of this happening now.
San Antonio in America, San
Texas, yes.
Texas, they closed totally all the malls,
Wow.
all the grocery stores.
Yeah, so they're taking precautions, yeah. Right now, Italy just closed their schools too, right now, I heard on the BBC. They're like, yeah. Yes, Japan as well, yes. So it's important to kind of keep yourself isolated, keep yourself clean. Don't expose yourself to areas and pathogens so that you don't get it. And if you do get it, if they test you, then there's a protocol that you'll follow. But don't panic. Keep yourself hydrated. Take your vitamins. Keep healthy. Eat well. Eat clean. Don't eat a lot of fried foods. This lunch was excellent. This kind of food was great. If you have this kind of food more often, you're doing well. Okay? Any other questions on the coronavirus?
for the IV, you have to have a doctor's prescription or something?
Yeah, we do it at our office. You just come in, you say, I want an IV immune boost. And normally we charge over there for regular people, we charge $250. But for if you come through Olive and through Wali, we do it for $99. And then if you have Medicare covers it as well. So then you don't have to pay anything. So it's very, if you...
Medicare, you have to have an insurance also, no secondary.
no, Medicare itself, yeah, only straight Medicare covers it, yeah. So, yes, sir.
What are the symptoms, severe symptoms?
So severe symptoms, what do you look for? So unfortunately, there's nothing different from the common flu. So you have sneezing, coughing, sore throat, and a fever. So sneezing, coughing, sore throat, and a fever, and they'll have this. And if you have this, then and it persists for more than 3 days, and it's a viral component. So it's just like any other virus. So that's the issue, that they can't recognize it until they test it. Until they test it, then they'll recognize it as the coronavirus, COVID-19 they call it. So that's the major problem that we have, because the flu virus is very rampant. A lot of people have colds. So there's a lot of people that have colds and they think, oh my God, I'm getting the coronavirus. It's really not the coronavirus. Just kind of, take your fluids, keep hydrated, take care of yourself. You'll be fine. But if you feel that it's persistent and you might have been in contact with someone that came from China or Iran or Italy, these kind of places, then go get seen right away so they can test you. Okay? Anything else on the coronavirus?
At what time do you give the infection? Suppose somebody has,
At when? I'm sorry.
when does a person pass on the infection, what is the...
So the incubation period, they say it's the first 14 days. So before you even exemplify any symptoms, they say there's a chance that you can pass it. So there are people that have traveled that have exposed themselves to those people that had it and got the virus, but it's not showing yet. So they're walking around normal, they feel they're okay, and they haven't revealed to anybody that they've connected with some. That's the problem. Now you're going to get a lot of delayed incidents, people that are after 2 weeks, 3 weeks. I had in my children's school, they told me, hey, we have this new family from China, they just enrolled. And they said that, oh, they've been here for 2 years. One of my kids said they've been here for 2 years. I told my kid, I said, ask them, say, when did you come? So she went and asked them, and he told her that, oh, we came from China January 14th. So, but the word was that, oh, we've been here for 2 years. So this is an issue. People don't reveal, so just be safe yourself, control what you can, and no need to panic. So that's the issue with that. Okay? And then if you want more information on the IVs, Priya's here from Genesis Medical Center. She can help you if you wanted to schedule yourself or come down and get your IVs done. That's not a problem. Yes.
On the symptoms, I've heard that a lot of people suffer severe respiratory distress.
Yes. So the virus affects your respiratory system, which is your lungs. So you've heard of all the deaths happening. Unfortunately, all the deaths have been in seniors. No kids have died from it. So the number one issue are the seniors that have other exacerbating problems, like they might have asthma, COPD, diabetes, these kind of things. Seniors that have other concurrent problems, it hits them severely. So that's why it's important that you boost yourselves, because this segment of the population, and if God forbid it gets you, it deteriorates the lung function quickly. So that's why it's very important that you kind of immune boost yourself early on. So that's and usually it's from pneumonia. The fatalities are from pneumonia, or they get excess fluid building in the bottom of the lungs, and they get edema, a lot of edema. So that's what it is. Okay? So that's coronavirus. So we were going to talk about general pain management in seniors. Of course, let's go through this a little bit. We don't have to go through all of it, but just... So that's me, right? My name is Dr. Azar. We're from Genesis Medical Center. We're an integrative clinic. We try to keep patients off drugs. We try to do what we can without drugs unless it's absolutely necessary. Because a lot of these drugs that we take have a lot of side effects, and we don't want to be, ruining one thing and fixing another. So pain management, it's important to recognize, your pain and what it emanates from. So a lot of people, who has arthritic pain here? Arthritic. Anyone has arthritic? Okay. Arthritic. No arthritis on this side? Arthritis. So that's good. They know they have arthritis. The number one issue is for cognition. We have to identify our pain and know what it is. A lot of people don't know their pain. They come into the office with generalized pain. They'll say, you know what, doc, I have shoulder pain, I have neck pain, and they go on with 20 different areas, and you don't localize it. So my recommendation to you is, anytime you go to your doctor, think yourself, what are the top 3 things that I have a problem with? What keeps me from my daily activity of living? And then you'd explain that to your doctor so the doctor can focus on those things and actually help you. If you go into your doctor and you give them 4 or 5 or 6 or 7 or multiple things, the doctor's just going to be, okay, well, this person has a lot of problems. Let me just give them something. And then when you come back, we'll deal with more things. But if you go and say specifically, hey, I have shoulder pain. I can't move my arm. I can't do what I used to do. I need help with this shoulder pain. Then he'll focus and take care of that for you. And in terms of arthritis, since it was brought up, the normal thing for arthritis is, number one, you go to your doctor. The doctor will recommend physical therapy, right? They say, hey, we're going to put you on physical therapy. You try it for 4 to 6 weeks. If it doesn't improve, come back. So you go to your physical therapy. The physical therapy might be very good, help you, alleviate the pain. Or sometimes physical therapists overstretch you and aggravate the pain. So you have to be careful, and you have to raise your voice. The caretaker of your health is you. Don't let anyone manipulate your health or overbear their own opinions on you, because you know exactly how far your arm will stretch and how far it won't. So when you're at a physical therapist, if he's hurting you or you're stretching too much, tell him. Raise your voice. You have to do that. You can't just be quiet and say, okay, it's going to finish. Don't do that, because he's ruining your body. It's very important. I get a lot of patients after we help them. They're pain-free. They go to physical therapy. They come back. They're like, oh, I've got more pain now. So it's very important to be aware of that. So physical therapy. You go back. The next step is steroid injections. If you still have pain, right? They say you either get epidural injections in your back for the pain, or you get the joint injections with steroids, and they'll give you usually a course of 3. You'll get them every 4 to 5 weeks, and hopefully that'll help. For some people, it helps, and you don't get the pain again for 2-3 years. It covers and masks the pain. It doesn't get to the root of the pain, but it covers it, and you get relief. You move around for another 6 months, 9 months, 2 years, and you're fine. And then you go back again. If you go back again, then they give you the surgical option. They say, well, we've tried physical therapy, we've done the steroids, now there might be something physically wrong. They've done an x-ray, they've done an MRI, and they'll say, well, we'll have to go in there and explore if it's not something not obvious. But if it's obvious, then they'll say, oh, you have a tear, we have to fix the tear. Then you become a surgical candidate. And then surgery, depending on what area of the body, there's percentages and probabilities of how successful surgery is. For the knee, for the shoulder, you get maybe 60% success rate. For the back, if you're doing back surgery, it's a 60% failure rate plus. So if anyone recommends back surgery, I always recommend to everybody get a second opinion. Always get a second opinion. Don't just jump into surgical procedures. So that's the thing with arthritis. Alternatively, what we do with our patients when they come to us for arthritis, we do what's known as PRP, platelet-rich plasma, which is a product from your own body. We take your blood, we spin it, and we inject that into your area of pain. And that usually has a healing and actually tackles the source of pain. Usually when you have arthritis, it's usually because that joint has become inflamed. The basis of arthritis is inflammation. What causes inflammation? It could be a wear and tear. It could be the types of food you eat, a lot of spicy food. It could be the processed foods that we eat. We're not balancing our alkalinity and our acids in the body. Too much acid production causes inflammation, and it hits the joint. So we'd have to assess what's wrong. And then we figure that out, and we inject the PRP, and then we also give you recommend dietary changes in your life so that you're not so acidic. Okay, so that's basically what we do. Sometimes if you have severe pain and it's been more than, yes, sir?
I understand from my research that PRP is not one-time solution.
It's not a one-time?
You have a repetitive, maybe 3 or 4 times.
3 times to get 95% efficacy.
But again, the pain after performance of the shots
Yes.
can take up to 6 weeks.
Depending on your health, yes. Depending on your health. So there are people that experience relief within 7 to 10 days, and there are people that experience relief after 21 days. It depends on how your body metabolizes the healing products.
And again, for example, I got a knee osteoarthritis.
Yes.
And my cartilage is gone.
Yes.
And doctor recommended PRP will not help you.
Right. So depending on your bone, they told you you're bone to bone on your knee?
Yes.
So it depends on the percentage of which area.
The cartilage is completely gone.
For the whole knee?
Yes.
Right. So if they told you that, then they'll tell you you're a surgical candidate.
Right.
But the PRP will still help you get cytokines and growth factors in the area to modulate the pain. It'll still help you with the pain. Sometimes we have clients that come in, they don't.
It will pain management or will cure it?
It'll manage the pain because you have the pain mediators. There are studies that show that combined PRP with stem cells has regeneration qualities for a cartilage.
But stem cell is not recognized by the medical industry.
Not yet. Not yet. It's being done because there's a strong push from the surgical side. They don't want it to, there's politics in that. But there are studies, white papers. If I get your email, I can send them to you. That show that stem cells combined with PRP actually have regenerative qualities for the joints, specifically the knee and the shoulder. So that's because probably your left knee, the percentage of erosion of the cartilage was less. So an orthopod or someone that sees, when they tell you you're bone to bone, they only have to see one area of your joint that's bone to bone. They don't have to see all of it is usually not all bone to bone. Because when we look at the graphs, we'll notice that one area is bone to bone, then they just classify you as bone to bone surgical candidate. And so that's what we do for arthritis, and we do it for multiple joints at our facilities. And we've been doing this for about 5 years, since 2013 actually. We've been doing this. So and we've gotten in our own study of joint disease, probably I could say 75 to 80% experience 50% or better relief after the procedure.
You do mostly PRP.
PRP, and we do stem cells. If your pain has been more than 2 years.
But stem cell is not covered by insurance, right?
Right. Stem cell is. There are some insurers now that are setting up a code for stem cells, like Cigna.
Yeah, but I'm with Kaiser. Kaiser does not.
Oh yeah, Kaiser, you have to go to Kaiser. Kaiser won't do it until it's like, yeah, unfortunately. Kaiser is a good system if you don't get sick. I tell all my seniors, I say, if you have Kaiser and you get sick, then it's, you gotta be on them to take care of you. Because they have a system, and if you're not, if you don't follow that system, they don't care, So it's very important to be aware of that. So that's what we do for arthritis at our place. And then, the normal, you take NSAIDs for pain, right? Non-steroidal anti-inflammatories, ibuprofen, paracetamol. You guys take that regularly. Chronically taking those things ruins your liver. Yeah, collagen is a good thing. We recommend collagen to all our joint pain sufferers because collagen actually, it builds up the lining of the capsules of the bones. So it's very important. A lot of people in the old days, they would have the hooves of the lamb or the cow, the sticky parts, and you slowly cook it. That is great. That's great for joint. It's the same thing. It has collagen. It has glucosamine.
And some of the exercise which I do, that's also really helping.
Yes, yes. So there are these types of supplements. Nowadays, people that have joint pain, when they come to our clinic, if they get PRP or stem cells or anything like that, we always tell them to take collagen for 6 weeks and also CBD oil. CBD oil is an anti-inflammatory oil. You can rub it on or you can take a drop under your tongue every day. And it's very good and anti-inflammatory. So,
Excellent, I use that as well.
exactly. So
I use turmeric.
turmeric is good too, yeah. Turmeric is anti-inflammatory. It's very good. The turmeric, and you can mix it with a little bit of black pepper to get absorbed. So it's very important.
What about arthritis? Just to be on the safe side, can you take precautions before?
Yeah, so you could do it preventatively because it's very important to not have your joints deteriorate. As you get older, as there's more wear and tear, you don't want it to get worse, so you want to maintain it. So there's a lot of athletes that come to our office, and they're basketball players, football players, and they regularly get PRP on their joints to maintain their joints so it doesn't get worse. A lot of people, these professional teams, they do it. A lot of the high school teams now do it, college teams. They give the joint injections of PRP to maintain the joints. So for pain, you take the non-steroidal anti-inflammatories, and then the next thing is if your pain still persists, then they'll give you the opioids. Nowadays, we have this opioid crisis. We have many people that are kind of hooked to drugs, medicated drugs from their doctor. They can't stay away from it. They come and they seek the drugs nowadays. So you want to be careful especially because if you go get a tooth procedure or you get some procedure, the doctor will give you hydrocodone, right, which is Vicodin. And that's highly addictive. It's highly addictive. A lot of people are suffering from that addiction because they take it just for their pain, and they don't know after 4 or 5 days of it, their body gets used to it very quickly, and you'll have withdrawal symptoms. So my recommendation is always don't take the hydrocodone, don't take the Vicodin, any opioid-based medications like that, stay away from. You don't need it, and unless you're in absolute severe pain and you can't handle anything else. So it should be the last effort to get that. Those are the things that they give you. Let's see what else is on here. So I told you this, the determination of pain, right? So you know what your pain is. When you go in, you have to describe your pain and try to be very, very specific. Don't let them guess. Because the issue is this, right? If you want a customized treatment for you as an individual, you have to explain yourself to your doctor and not confuse them, right? If you want that doctor to give you a specific treatment for you and not just a general, I'll give you ibuprofen twice a day and we'll see what happens, come back. You need to be, driving that effort when you talk to your doctor. It's very important because the way his treatment of you and his protocol depends on how well you explain your symptom. It's very important to do that. So this is, pain is always subjective, right? You could be walking in with a pain 9 out of 10, and the way you explain it to them, some people don't like to exhibit their pain. They're very shy. They don't want to, especially men, right? Men, they want to tell them that I'm hurting or anything like this. So when you go to your doctor, you got to let him know what you have so that he knows exactly the severity of it. If he doesn't know, he's going to just give you some generic-ish thing, and then you'll be back in there 4 weeks, 5 weeks later. So it's very important to do that. So this is just going through acute pain, and there's chronic pain as well. I think you guys know that, the differences, right? So some people have cancer, right? So this is one instance. Well, they'll give you morphine, which is an opioid, and they'll give you heavy medications to deal with that pain. And if you or you know someone that's been through any type of chemotherapy, it gets really the pain tolerance it surpasses that of most people. So in that case, opioids are generally okay to take for a short time. Again, even then, there are people that take high-dose vitamin C. Very high-dose vitamin C also buffers that. So this is what I was talking about. When you go to your doctor's office, right, you want to tell them the location, the intensity, and the sensory quality of the pain, because you have to get that across. A lot of people don't. They just give a number and that's it, and they don't tell them whether it's a dull or aching or shooting pain, or does it go left, does it go up, does it go down. You have to be specific. This is for people that are usually in a hospital setting. They reassess the pain evaluation every 8 hours. They'll check on them every 8 hours. So this is a protocol where your doctors and nurses, they assume your pain is present. That's what we're taught. When you come in, to assume that the pain is there, but we have to quantify it. Okay? So they look at face, legs, activity, if you're crying or not, and consolability, how quickly you respond when they try to console you. These are all factors that they take into consideration. OAAS, Observer's Assessment, Alertness, and Sedation, to see if you're... Some people come in, they have so much pain that they kind of go in and out of consciousness, and that's severe pain. Those people need morphine in a hospital setting. There's nothing that quantifies pain. That's the problem, see? Because your pain and my pain, two different levels. Like I have hip arthritis, right? So I went on a trip with Wally to Jerusalem, and it was early morning, Fajr time, and he called me and said, hey, let's go. And it was raining, and it was cold. And we got out of our little hotel, we started walking, and we had to walk fast because it was raining. And my hip is arthritic, so I was walking fast. And then halfway, I was like, hey, I'm getting this severe pain. Hold my hand. So he was holding my hand, and we're walking to Masjid al-Aqsa to do Fajr. And then we got there, I'm dragging my foot at the end of it because it's cold, and it was like 34 degrees. It was just this last December. And it was really cold, so we went, we prayed, and when I got out, my hip was frozen. I could not move. I had to sit down. He had to go with someone to the hotel, bring a wheelchair, and sit me down and go. So it gets that bad, so that's the threshold, That was it, I had it, it was done. And then I had to come back, and then I came back, I got PRP, I got stem cells, and then finally in mid-February, it started getting relief. And now I can, jump again. So that's how severe the subjectiveness is, So there should be an interdisciplinary. So this is what I was talking about before, right? So you get the NSAIDs, the pharmacologicals, right? Gabapentin. A lot of people nowadays, it's very fashionable to give you Lyrica or gabapentin for nerve pain. If you have shooting pain, they'll give you Lyrica or gabapentin. Then they'll give you, non-steroidal anti-inflammatories. And then, of course, this is another thing you can do, alternatives, biofeedback, deep breathing, relaxation techniques, yoga. The trend now is mind, what do they call it? They call it presentness, right? You have to be present. Mindfulness, there you go. So you have to be mindful. When you're mindful, you breathe, you know where you are in the space and time you're at, you alluded to that, and that will help your level of pain decrease. So if you can do that, and even if you can do it for 5 minutes a day, just get out of it, get out of the hustle and bustle of life and just have that mindfulness moment, I believe that if you do your prayers, those are your mindful, it's meant to be. One of the purposes is to kind of leave your hectic daily life and go and, talk to God or pray, and that calms you down. Exactly. So that's mindfulness. It's very important to, have that sense.
Your brain.
Exactly. And that helps a lot of our clients that come in and they do breathing exercises, they do yoga, they pray, whatever they do, it works for them and it decreases their intensity of that pain. So that's very important. And then the last ditch efforts are regional analgesia, which is done through anesthesia. They'll do a nerve block on you, right? When doctors can't do anything else, no medication, they'll say, hey, we'll put a spinal cord stimulator, or they'll do a nerve block. Meaning that nerve that innervates that area, they'll block it with medication and they'll numb and dumb it. So you don't feel anything and you can still walk. So that's the last thing. Some people, nowadays they've decreased it, but before, people used to get there very quickly, the nerve blocks. So treatments, right? So you have the pharmacological methods, right? We just discussed all that. And then you have the non-pharmacological on this side. Heat, cold packs, right? Relaxation, we just discussed. PRP, cell therapy, guided imagery, acupuncture, and then what they call repositioning, where you do a lot of modalities. Now they have all these things called the stretch lab. You see these franchises coming out. You go there for an hour and they help you stretch. That's all they do. They just help you stretch. And stretching and exercising yourself in the morning and in the evening will do a lot for your joints. It's very important for joint pain. Okay? And then of course the PRP and cell therapy, I explained to you guys what that is. So there are pains, pain syndromes they call them. There's several types of pain syndromes where one of them is from people who've had some type of trauma. So a lot of people, it's good Wally's here, he does all our counseling. So a lot of people will notice that if they've had some type of mental trauma, they'll take that mental trauma and it'll transfer into some type of biological pain on the body. And whatever you do, you can't get rid of that pain until they're mentally sound. Meaning that just like we exercise our body to keep our body fit, you have to do things to exercise your mind to have mental fitness. It's very important. That's why at Genesis we take the body, mind, and spiritual approach. Because a human being is not just a body and they're just not a mind. It's a combination. So we have to address both at both levels. So we call it the psycho, spiritual, biological system mode. So it's very important to take that into consideration. A lot of our clients will come in and they have this persistent pain. We do everything and they still have it. And then I notice that they have a stressor in life. They have some type of issue that they haven't resolved mentally in terms of whether it's anxiety or they've had a divorce or they had some issue. And then, I refer them to Wally to do 1 hour sessions twice a week, once a week. They come for 4 to 6 weeks and try to resolve that. So they can let that go. Once you let that go, then you can experience complete health. It's very important, and because it's all interconnected, right? Our bodies are interconnected. Yeah, so this goes over responsible opioid prescribing, because if I, usually in a crowd of 10 or 15 people, when I ask who's on an opioid, we'll get 1 or 2 people that are on opioids for one reason or another. So you have to be careful with that. That's more of the same. And then you'll find a lot of people that have different pain syndromes, or they're addicted, they'll go doctor shopping, right? They'll come to one doctor and say, please prescribe me this. Then they go to another doctor and they say, please prescribe me this, because they need that medication. Because now they have this thing called Cures, it's a database. So once you get prescribed an opioid, that's on there, so it comes up, it'll pop up in your electronic medical record. So the doctor knows not to prescribe it again to you. So a lot of doctor shopping does happen. And then it's important for people who have pain syndromes that their family and support system understands the pain and what it is and empathizes with the person. So if you have a daughter, granddaughter, or grandson, or a husband, or they're always complaining about pain, and you haven't understood what their pain is or what that cause of pain is, if you do understand that, it'll help them have less of an intensity of that pain, experience less intensity with that pain if they have someone else understand their pain. as opposed to just being like, oh, we understand, you're always complaining about your pain. So that's very important as well. So family education, that's what I'm going to end on that. So I don't need that anymore. It's very important for those in the support group or the support family, or even a group like this. You guys are friends, you get together once a week or twice a week or whatever you do, for you to understand each other and what your pain is and what it emanates from. And that'll promote healing. Wally mentioned the social setting. There's a guy I studied under in University of Arizona in Tucson, Dr. Andrew Well. He's from Harvard. He's got that big white beard, bald guy. You see him, he writes a lot of books. He's on TV a lot. So he went around studying different societies and why they live the longest. So he went to Japan, he went to Bolivia, all these weird, far places, villages that people live long, and they didn't have disease, and they were very happy. And the number one thing he found was it wasn't their exercise, it wasn't their diet, it wasn't any supplements they took. The number one thing they found that affects longevity of life is their social connections. So if you have good social connections, if you have a friend that you can sit and laugh with, discuss life with, and just have a 20-minute conversation and just relax and be yourself and enjoy, that'll improve your health better than your hour of exercise with. So it's very important to have that regular contact. Yes, but there's a hadith of the Prophet, right? How can you increase your longevity? Through dua. Through dua.
From dua also,
Exactly.
dua also, you cannot ask for.
And what's the best dua? And what's the best dua? The best dua? What? The best dua are the ones in a group.
Yeah, the group you can.
The
do
group.
dua.
So it's always, we go to, right. But my point is the social setting. So even when you make dua, the Prophet ﷺ said the group dua is much more effective. Why? Because you're in a group and you're feeling good and you're making dua and you're more sincere, right? There's chemicals there's hormones, chemicals, everything that balances your body. In a group setting, those are much better and less negative. So it's very important to do that. In case of emergency, you can, ibuprofen.
Which type of pain you have?
Yeah.
A stomach pain or a
So,
headache or whatever?
so generally anti-inflammatories are okay. The NSAIDs, they don't cause a lot of damage if you take them limitedly. The NSAIDs, meaning the non-steroidal anti-inflammatory. So ibuprofen, paracetamol, these over-the-counter ones that you take, those are fine. If you need a stronger one, then they mix it with codeine. The doctor will give it to you. But that's an opioid. I would stay away from that. Yes?
Tetanol, things like that, in case.
Yeah, you could take extra strength.
You try to avoid, but
So what I tell my patients after they get PRP, I tell them to have extra strength Tylenol if you still get pain, because that's less effective on your liver, and then as opposed to ibuprofen. But it depends on what else you're taking. A lot of people are taking other things, So it's based on the individual.
Mindful of
Your
that.
posture is very important.
That's the right word, the posture.
Yeah, so that's very important. I tell my kids always to sit up straight, don't slouch, don't. Nowadays, here we go. Everybody's looking at this like this. So there's a new condition. It's called tech neck. Tech neck. They come in and they're like, oh, we have pain here. Young people, 14, 15-year-olds, they come, oh, my kid has all this pain. And they don't know why. And it's the screen. Because everyone's like, if you're going to use this, put it up. Hold it up. Don't be like this. Hold it up, yeah. If you hold it up, it's much better for you. Better for your posture. And it also makes you use it less because you feel embarrassed if you're holding it up all the time. Right? Yeah. Yeah. So hold it up. And then, they've tested the effects of the screen time. Too much screen time numbs and dumbs you. Especially if you're older, things to keep your mind, sharp is always to learn a new thing, learn a new language, do something new, those games you guys mentioned. But staring at a screen is detrimental to your neurons in your brain. Okay, well, thank you very much. And then hopefully we'll see some of you come to Genesis. Wally knows where we are. Come get your IV vitamins. Stay healthy, stay happy. And then, we'll see you again. No problem. Thank you.